plans. I also oversee the self-funding, disability, critical illness, group ancillary, and voluntary benefits. For those of you who may be unfamiliar with URL and who we are a family-owned full-service brokerage firm offering all lines but property and casualty, and we have been in business going on 30 years. And we are located in Harrisburg, Pennsylvania, which is the capital of Pennsylvania for those of you. You have a history lesson today. We're kind of in the middle of Pittsburgh and Philadelphia. But that being said, we license thousands of independent insurance brokers and general agencies all over the United States. And we have partnered with hundreds of what we believe to be the best insurance carriers in the market today. And as I said, we do have very distinct divisions here at URL, which include individual health, group health, individual and group ancillary, senior care products, annuities, and life insurance. So if you have not checked us out before, this is our website. I'm not going to take you through the entire website. We've got a lot of material to cover today on the self-funding, but these are our different departments. And in your time, you can go through them. Who we are, we do have rewards and incentives. We do weekly training on, in each of our different divisions. We do training. We have case managers that follow all of your cases from submit to issue. If a case is declined, we'll shop it for you. Essentially, we like to be your back office and help you work smarter, not harder, because we want you out there selling and not having to worry about where your case is and underwriting and all of that. So again, here's our website. I'm going to give you my contact information up front, so it is right here. And obviously, you got my email address because you got the invite. But my email address is there, my extension. You can also contact John Reel in my office, who helps me with the self-funded, the group gap, and those type of products. And again, this is our web address, urlinsgroup.com. The user ID is Grand. The password is Cayman, and we kind of did that on purpose. We do incentive trips, and our trip in 2016 is to Grand Cayman. So, and again, all of the business you write through URL has a point value. So you don't have to write just one life carrier to get their trip. So if you write an annuity, you write a senior care product, health, group, ancillary, it all goes into one big pot, and that's how you qualify for our trips. Everybody is muted on the line, so if you have questions going throughout the presentation, please type them in. We will cover all the questions at the end of the webinar. And the agenda today, what we're going to be going through is basically the current landscape of health insurance, secondly, the advantages of self-funding versus healthcare reform, fully insured versus self-funding, and participant engagement strategies. And if those of you, self-funding is kind of relatively new to me too, but if you're unfamiliar with it, we're going to go through the ins and outs and how that works. I see, especially in Pennsylvania, the group renewals come in, and in whatever state you're in, the renewal rates are the renewal rates. So if you're you're writing Health America, the Highmark, the Blues, the rates are the rates. So if you're going into a group and there's an agent coming in behind you, he's not going to have any different rates than you are. So I think it's really time to think outside the box. If your client's premium is $500,000 a year, he's not getting any of that back. So with self-funding, there's the opportunity for that. So I'm not going to steal Bob's thunder. Who's going to present next would be Bob Doretta, and he's Director of Brokerage Sales with Group Benefit Services. So I'm going to hand the presentation over to him. So Bob.
Thank you, Christy.
Bear with me.
Okay, and we're kind of a unique TPA where we manage our own self-funded groups. We process all the claims and everything right in our own office. So we have multiple options from multiple states. And what we're going to go through today is a self-funding overview, like Christy was describing. We're going to walk you through our what's called Healthy Solutions, which is a self-funded plan with a built-in wellness to help engage your employees moving forward. And then we have our partner, Chris Mueller from Healthcare Interactive, who's going to show you a demo of Healthy Solutions, what your employees would see, and what the roll-up would be for the employer. Okay, and then at the end, we'll touch base on how you can submit a quote and what requirements there would be for submitting one. So Dave Cardwell, who's our Senior Executive VP, will take us through the initial slides for the presentation. Thanks.
Alrighty. Thanks, Bob. Alrighty, as Christy had mentioned, we're going to just touch briefly on the current landscape of health insurance because obviously it's especially in the small group market, there's a lot of chaos going on. And the large group market, we have the pay-or-play challenges. So we'll touch on that a little bit. And then the self-funded, fully insured versus self-funded, and then the participant engagement, which is the Healthy Solutions product that Bob was talking about. But first of all, the first things that's going on, and from what I understand, the audience is primarily fully insured brokers. So I'm just going to touch on the fully insured landscape, and then you can relate it to self-funded because that's the new growth industry right now. And so the current landscape is, and this pretty much holds true in almost every single state. TBS has clients in all 50 states, so some of the things holds true for most states. There's about a half a dozen carriers in each state. So your client gets a renewal. The first thing they want to do when they get their love letter from the carrier saying it's going up 20, 30% is to shop all the carriers. So we have about a half a dozen carriers in most states. And then they want to shop for higher deductibles, higher co-payments, or co-insurance. So, I mean, obviously that's the only way to get down premium. The other option is to raise payroll deductions from the employees. These are all three different methods in which employers are trying to maintain their budget in the fully insured world. And in the small group market, it's hard to justify the increase because you don't get any claims experience that would indicate why you're getting these kind of increases. So obviously in the small group market, that's pretty frustrating for most employers and brokers to justify these increases. So the big question is, what are you going to do differently this year that you haven't done in the past that's going to make a difference? And that's our segue into self-funded. So should you consider self-funded? Now, do you think, a couple of the questions you can ask your prospects or clients is, do you think your claims in your company are lower than your premium? I mean, if most employers say, yeah, I think my claims are lower than my premium, then that might be a good candidate right out of the gate. If they say, oh, no, I have a whole bunch of big claims going on and I'm 20 employees, they may not be a good candidate, at least for self-funded this year. Do you want to see where the claim dollars are going to at least justify the increase? Do you want to share the rewards when you have a good claim year? Do you want to see an alternative to the same old, same old? Because the first slide, I've been doing health insurance for the last 34 years, and before we got into self-funding, that first slide pretty much for the last 34 years has been the same old, same old. Shop all the carriers, raise the deductibles or co-payments, or take more money out of the employee's pay. Generally, options you had to maintain your budget. So self-funding. As the cost of health care continues to escalate, more and more employers are looking for a cost-effective solution. So they're looking to get out of the box. Now, in the fully insured world, health HRAs, or high deductible plans, have been out since 2004. And so for about 10 years now, the early adopters realized that by raising the deductible, it lowered the premium. And each year when they got their increases, they kept raising the deductible. And what happened was the early adopters hit the ceiling. There was nowhere else to go. So obviously at that point, employers are looking for alternatives, and self-funded is that natural alternative, which we'll talk more about. But self-funding offers employers a powerful, practical alternative to traditional insurance. It allows the employer to pay directly their actual claims while limiting the risk by buying stop-loss insurance. And stop-loss insurance really comes in two different ways. The specific stop-losses protect an employer against an individual within a company. And then the aggregate stop-loss insurance is to protect the company against collectively all the employees and their dependents having claims that you want to maximize your annual exposure. And what most people don't realize, if you haven't been in the self-funded business, even employer groups that haven't really looked at self-funded before, they don't realize that 65% of all Americans covered in the United States are covered by self-funded plans because all large companies self-fund. I look at self-funding, and I refer to it as the best way to finance your healthcare expenses. In the traditionally fully insured world, you pay all your premiums to the insurance company for exchange of small deductibles or co-payments shared by the employees, and that's fully insured. The carriers have the promise to pay all the claims in exchange for small out-of-pocket expenses. Now, the middle bullet here is what's happened over the last 10 years, and people quickly realized that high deductibles lowered the premium, and you could take that premium savings and basically self-fund or pay for those out-of-pocket expenses with HRAs, HSAs, or even FSAs, what I refer to as the A-list. Now, usually when I'm doing face-to-face seminars and a bunch of employers, when I ask the room how many people have done this middle bullet, have put in high deductible health plans, and they're paying for out-of-pocket expense either with cash from the A-list or maybe gap plans, most of the people raise their hand. And for you, HRAs or HSAs, what I tell them is what they don't realize is they stuck their big toe into the self-funded market. HRAs are Section 105. That's what makes self-funded legal. And so they didn't realize that they're actually self-funding. It's just on a fully insured chassis, just paying for out-of-pocket expenses. And then, and obviously the self-funded world is really taking that same concept of HRAs and just raising the deductible even higher and putting that aggregate stop loss in there to protect you against a maximum exposure. And so it's just really a continuum of what most people have been doing in the HRA market. So, and then we have, self-funding is coming in really like 3 different groups of employers from small to large. Now, I think we have a mixed group of people online today in different states. So each state has their own rules of what size, and we'll talk about that a little bit later in the seminar. But right now, in a lot of states, we have small group self-funded plans that go down to 5 covered employees. And once you get down into the small group self-funded market, we have simple turnkey packages similar to what carriers have. You have specific plan designs already picked, and then you choose from those different plan designs just for the ease of picking the plans. And then the term level funding is being widely used right now, which describes being billed at the full premium, maximum premium equivalent. And what that means, you're getting billed your stop loss premium administrative fees, but you're also getting billed that maximum claims fund. And then we turn it into a 4-tier rating methodology like the small group used to be, and a large group is currently, where you have an individual, family, parent, child, husband, wife rate. So the small group self-funded plans look like the old days where you have the composite 4-tier rating. And then underwriting. Underwriting is a little bit more involved in the small group self-funded market because, and I know the Pennsylvania folks and some of the other folks, you were used to groups in the smaller market doing individual health questionnaires, and the small group self-funded market is still that way. There's individual health health statements, so the underwriters can determine whether or not the small group self-funding is right for them. And obviously, even in the small group self-funded market, you're going to get claims experience. So even groups 10 to 5 are getting, where the money's going for hospital, surgery, RX, emergency rooms. So you'll see where the money's going, so you can make adjustments for future years, or at least justify your increase if you're getting one. So that's a small group market. Now there's a mid group, and this market is changing. We have probably a couple dozen stop-loss insurance companies that are coming into this retail market, and more of them are starting to drop down into the smaller companies. And the mid-market, we're calling that 30 employees to 100 employees. And once you cross over into that market, now you can do custom benefit designs, where basically our first method of quoting is just to match what they currently have. Because a lot of times it's easy to compare apples to apples, and then you can get creative on benefit designs. But in the self-funded world, you can get a lot more creative in the benefit designs, so it's not the canned packages. So 30 starts to mark that blank piece of paper, just tell us what you want in benefit design. We still use level funding because all these groups are still in the fully insured world. So in that level funding, billing at that full premium, maximum premium equivalent is how they view their fully insured world. So it just looks like fully insured premium. Then the underwriting, once you get to that size, now you can begin to use what they call group health statements or group disclosures. So it's like the large market where, the best of your ability, are you aware of any of these claims that are going on that the employer is attesting to? And obviously, then you're still going to get the increased claims experience. Now, the small and medium size self-funded groups, when I say increase claims reporting, you're going to get more information you possibly imagine, but even then there's standard reports that we have. We don't do ad hoc groups until you're over 100, where you can where we have to get creative and get out of the box if you want to see anything special, and predictive modeling. So that's the mid-market. And this is the market that's probably changing the most. We just had a couple more carriers enter this market, so we got about a half a dozen stop-loss carriers that are in this market right now. And then the large group markets has been around forever. GBS has been paying claims for about 30 years. And when we first started paying claims, it was all the large companies that were self-funded. And this is the methods in which they did it. They always knew they could get creative in benefit designs. But the zero balance account is what all the larger companies do, where we only invoice the fixed costs, which is the premium and the administrative fees, maybe the broker fees. And then the claims, we don't invoice at all. We actually give them a report once a week, what the claims were, the check register, and then they put that money into an account, and we sweep it and then pay the claims. And that's referred to as a zero balance account. So they have the flexibility of using cash flow when there aren't claims. So that's the advantage, or the way they view zero balance accounts, because they're not in the full premium equivalents. The companies are paying this money to us, and we're either holding it or they're holding it, but that money's sitting there whether there's claims or not. So for the larger groups, they understand the use of that cash flow is a valuable feature. And then when you get to underwriting for large groups, the underwriters realize that once you go over 100, these groups are getting good claims experience. So they're going to want that to do their underwriting. So you do the group's disclosure, and also you get a lot more claims experience, which we'll talk about when we get to the RFP. Then you increase claims reporting. You can also use more predictive modeling if you want to change a co-payment or a deductible. What would that mean next year if you have the same claims as you had this year? So you get a lot more predictive modeling tools once you get into this market. This picture right here actually just kind of runs through all the words that I just said, but sometimes the picture, and a lot of our broker consultants use this picture to put in front of their prospects, their clients, really to talk about the concepts of the funding arrangements. And really, this is just walking you down the path where companies were, 10 years ago before high deductibles. The first bar chart is, I think this case study is 100 employees, and it's showing it's $800,000 in premium. So obviously the fully insured traditional, where the employees have $250 deductible, and then it's 100% coverage. So all the premium goes to the carrier, and then the deductible is the employees. But the next bar chart is when people entered into the high deductible health plans, and then they realized by raising that deductible, it lowered the premium. And then they use that savings to fund those out-of-pocket expenses. But you see across the top, right under the header on the bar chart, it says the employee has $250 deductibles. So the point of this case study is the employees can have the same benefits no matter what the funding arrangement is. So just for the sake of this case study, you can see the different funding arrangements where it's invisible to the employees. They just want to know what they're going to pay out of their pockets, and then the doctor's on the list. So for the sake of this exercise, the employees have the same benefits. Now, once you cross the third bar, that's our mid-markets, where we're invoicing the full premium equivalent. But you can see in most of our mid-markets self-funded plans, the fixed cost is about 50% of the claims fund. So you'll see that claims fund is half of what you're normally paying. So if you look at the bottom of that bar chart, you'll see $400,000 is the claim fund and $400,000 is the premium. So, and this is, if you're in that mid-market, which most of our brokers are, when you talk to an employer and they're currently paying $800,000, and then you show them this concept where it's the same, all things being equal, if their premium and the level funded is still $800,000, but half of it is sitting in cash, most employers will look at you and say, this is a no-brainer. So the reality is whatever cash is not used in claims, we're going to give it back to them because we were invoicing it and collecting it. All of this money under our TPA arrangement, the employer owns 100% of that claims fund. So at the end of that run-out period, we give 100% of that money back to the employer. And I can tell you, we give hundreds of thousands of dollars back. I think Bob just delivered a $260,000 check a couple weeks ago to an 80-employee company. I mean, they're the poster child. I mean, they're not all like that. But this group is consistently, over the last 5 years, getting hundreds of thousands of dollars back. And so they're on our brochure, one of our testimonials. And we deliver the big Ed McMahon check and the balloons and have fun with it, because most brokers are handing out renewals with increases instead of $250,000 checks. So that makes renewals a lot more fun. So, but that's at mid-market, and this is a picture that just shows how the premium, the fixed cost is going down and the claims fund or cash is going up. Then obviously the larger groups on the fourth bar, their deductibles are higher, because the larger the group, the more that specific deductible. So the higher the deductible goes, the lower the premium. Just like even in the fully insured world, you raise that deductible, the premium goes down. So in this case, about 100, I think there's some 100 employees. They're not doing the level funded, so they've been self-funded for several years. So you see the fixed cost is about 25%. So 600,000 is in claims fund, and 200,000 is premium. Now, when you look at this picture, even if you can't read it, and you're just looking at the yellow and the green, you'll see as you go from left to right, the yellow is what every employer at their renewal wants you to do for them, get down the premium. So as you go across, the premium goes down, and the actual claims fund goes up. And so it's a simple message on the funding arrangements for these healthcare expenses. Now this slide right here is really showing you the components between fully insured and level funding arrangements. And what most people don't realize in the fully insured world, or I should say level funding arrangement, we build it so it looks like fully insured. So what most people don't realize, when you send your money in, and the red block is all the fully insured premium, when you send that money into your fully insured carrier, we're doing the same thing with it that they do. You just don't realize it. So when you send your premium in, that blue is the administrative fees. So you send your premium and they take out the administrative fees. They actually buy reinsurance. Every company, every insurance company will buy reinsurance to protect themselves against you. So I can tell you, a group of 10 employees, your claims can be a lot more than what your premium is. So they buy stop loss or reinsurance. And then by law, they have to put a certain portion of your premium into reserves. All insurance companies, fully insured companies by law, have to have reserves set aside to pay for expected claims. I don't care if it's health insurance, life, disability. So by law, they'll have to do this. So when you send your premium in, you're going to put a certain portion in reserves. So that being said, when you look at those two bar charts, and one represents self-funded and the other one represents fully insured, and the fully insured building it the same way behind the scenes, the biggest difference between fully insured and the level funded arrangement is that green part on the reserves, on the self-funded, is who owns that reserve. In the fully insured market, the company owns the reserves, the insurance carrier owns the reserves, and in the self-funded world, the employer owns the reserves. So when you're sitting in front of your prospect or client, and you say, who do you want to own the reserves? What do you think they're going to say? So it's a pretty easy conversation when you have these kind of pictures. Now there's different types of level funded. What I refer to as the BUCAs are getting into the business, and that's all the larger national carriers. The Blues, United, Cigna, Aetna, they're all getting into this smaller or mid-size self-funded business. And they look similar to a very small, like that 5 to 30. They look like that, even though most of these carriers start at 25 plus, because you have to pick from their benefit portfolio. So the brokers are the stop-loss carrier. They pay the claims. You pick from their benefit designs. You pick from their network. But probably one of the biggest differences on who owns that claims fund. And in most of, like the Aetnas and Cignas, the Uniteds, they all own the claims fund. And so they have different rules about if you stay with them or not, on how much of it they give back to you. For example, if you left, most of the BUCAs, if you left them the next year or the second year, they keep it all. you keep all the money. If you stay with them, these will give you a fraction of what you use towards future expenses. So that's probably one of the biggest differences between independent TPA like DBS or the BUCAs when you're looking at these type of plans. So the next slide is really third-party administrators, which I refer to as the unbundled. The BUCAs are the bundled approach where they're doing everything. The unbundled approach gives TPAs or third-party administrators like DBS the opportunity to pick the best in class. And that's regarding, because we have a couple dozen stop-loss carriers, so depending on your size, your company, your location, we'll pick the best stop-loss carrier to be able to pick up that the risk. And they're the large international stop-loss carriers, and they're insuring insurance companies, so they're usually bigger than even some of the insurance companies you might be working with today. And then the TPA pays the claims. So we work for a lot less than what the insurance companies can. So usually our administrative fees are more cost effective. You can pick your own benefit design, get creative, and we'll talk about one of those benefit designs when Chris joins us, and he'll demonstrate a web portal on Healthy Solutions. So that's carriers don't even have those kind of benefit designs, so we can pick the best in class there. And then you can have multiple networks. Everybody thinks whatever carrier you're using locally, if they have a good network, but sometimes when you go into different areas, you might have employees scattered through the country, and you find out their network doesn't fit, or they don't have good penetration in a certain town. In the unbundled approach, we can pick great national networks locally, and if that network doesn't fit in some other location, then we can put a different network in there. So we do a geo-match and make sure we get the best network for those particular employees in that particular area. So that's still an unbundled approach that works well. And then finally, the employer owns 100% of the claims fund. And so we've had the BUCAs have been doing a pretty good advertising for these level-funded programs. And then if one of these clients go in with the BUCAs and they learn next year that our plan is kind of like the same model, but they own 100% of the premiums, they're usually changing to GBS or models like GBS, and so hopefully you're changing it with them, or the broker's losing the business. So it's important to know the difference between the BUCAs, the bundled approach, and the unbundled approach. This picture right here really describes why self-funded works. If you look at every single company, and the smaller it is, the more it might be skewed, but when we look at every 50 company and above, this statistic holds pretty true, and because everybody in the company doesn't have big claims, and we pay claims for hundreds and hundreds of companies. So, and usually about 67% of the employees won't even get through a $500 deductible. And if anybody's ever looked at HRA reports, you can see this. That shows all the low-end claims, and 93% won't get past $2,500 in claims. So then you have 7% of the companies, 70% of the employee population may have a large claim. And that's why you buy stop-loss insurance in the self-funded world, to protect you against those folks. Because the employer can fund, because that's proved by HRAs, that they can fund those lower, smaller out-of-pocket expenses. Now this slide right here has a lot of moving parts on it, but the reason why I put this up here is because it shows how the specific and aggregate stop loss work together, and as it relates to that previous slide, because this example right here, it's 50 employees that has $400,000 in annual premium. So in that size market, as I mentioned before, about half the money will sit in claims fund, and half of it is in stop loss premium administrative fees. So here you are, you have this plan, and $200,000 is sitting in cash, and there's a $30,000 specific deductible. And if it's $200,000 in cash, that's actually what becomes your aggregate stop loss. So if your claims ever collectively between all the employees and spouses and children go over $200,000, the aggregate stop loss pays the rest of the claims. And that's how you can say that's your maximum exposure. But using the specific stop loss, say you have 7% of 50 people, it's
3.5.
3.5 people. So using that example, so you have 3 people, say they each have $100,000 in claims. And so when they hit $30,000, the insurance company starts paying the rest of the claims. So only $30,000 comes out of the claims fund. So let's say all three of those people have $100,000 in claims, so that's $300,000 in claims, but only $90,000 came out of the claims fund. So if you had someone that had those kind of claims, which is rare that a company this size to have three having 100,000, you might have 10,000 or 20,000, but if you hit 30, it stops, and the specific stop loss carrier pays the rest of the claims. So that's how you can have these big claims and still get money back from the claims fund. But usually, if you have 3.5 people having the big claims, it's that half a person usually has the biggest claim. And even if they had a $400,000 in claims, only $30,000 comes out of the claims fund, and then the stop loss pays the rest. So that's how usually, when you're talking specific and aggregate, everybody doesn't have big claims, so you usually still have money left over at the end of the year. Now here's an example of, I picked a real group, and this was, the way stop loss carriers look at a group is when you get a quote, you'll see expected claims and you'll see maximum claims. Now everything we've talked about up to this point is always referring to the maximum claim, because if you have a prospect, that's what they're going to want to look at, and because everybody wants to know the worst case scenario, what's this going to cost me. But as I showed you on the previous slide here, it is rare that you hit the maximum because the specific kicks in on those high claimants. So in this case right here, we're showing you, I don't know if you can see my my cursor, but this chart right here is showing expected claims. And you don't get these bar charts. And when you see expected claims, it's the total premium of $1 million, and expected is, oh, I'm sorry, I moved to the expected. Expected was 464, and then the maximum was 649. So the probability is going to be closer to what the expected is. And usually, even in self-funded, the underwriters are pretty conservative. In a lot of cases, it comes in below even the expected. And you can't tell. Sometimes you have an unusually bad year, but for the most part, they're looking at the current employees, demographics, renewals, and they make a pretty good prediction. But I just wanted to bring up the fact that you'll see expected claims and then the maximum claims. Of course, the groups are always going to want to look at the maximum claims. That's worst case scenario. Now this is a slide right here that you'll see also from our proposal system that looks like fully insured. And that's what these smaller, medium-sized companies are used to seeing, a little spreadsheet showing, side-by-side comparison on the benefits. And then that you look down at the bottom, it looks like premium equivalent. So if it looks and feels like fully insured, then at least they can relate to it and make that analysis. But you'll see here on the green is the GBS self-funded plans. You'll see the difference down at the bottom here in yellow. After you have that $1 million in maximum premium equivalent, that 564 or 649,000 of it is sitting in cash. Now here's something that these groups are definitely not used to seeing. Once they understand the fully insured version, then you have to, and they're agreeing to this and they're buying into it, ultimately you have to show them the self-funded proposal. Now they're going to see how all those premium equivalents come together. So you have the stop loss premium, you have the administrative fees, the broker fees, the network rental fees. So at the end of the day, if they're getting ready to sign, they need to see all the moving parts. And so you've got the premiums, the administrative fees, and you got the bottom here, which is the aggregate attachment points. That's all the claims fund. So then you can see how it all gets built and comes together. But I can tell you, if you start with this page and they've never seen self-funded before, their eyeballs are going to roll back in their head. So you want to be careful. Show them the pictures on the bar charts. You show them the fully insured look-alike. And then you get all the moving parts once they get that part. Now, a lot of times, if these small or medium-sized companies are seeing self-funded for the first time, especially if you're getting late in the game, so they've had their renewal, they have to make their decision next week, and you're showing them self-funded for the first time, a lot of times they can't make that decision in that shorter notice on a new concept. So two things. One is to get out sooner before they renew to try to explain the concept. Secondly, if you didn't have that luxury and they don't do self-funding next year around, when you go to do self-funding proposal again, now you have a history. This slide right here is really showing a history on a group. If they would have been self-funded for the last 2 years, what would they have saved? So we can do this history chart, because now we have no numbers last year and the year before last, and then we knew what the stop-loss premiums were, so we can add that up and show them what would have been the potential savings. And usually after 2 or 3 years, when they see this, then they get it. So who's a good prospect for self-funding? Obviously, it's got to be employers that are looking for creative, cost-effective solutions, and not the same old story. Because you know, what's interesting is there are groups that are still getting 0 or low increases, and usually when they get a low increase, when they renew, they just want to know where to sign. And actually, that is absolutely the best time to look at self-funding, because it will look even better. No matter how good the fully insured looks, self-funding is just going to look even better. So if you have someone going, oh, I got a low increase, where do I sign? Say, and that's a good indicator that they're running, the claims are running really good. So that's when they should really be looking at self-funding. But you want a group that's financially stable, because they're committing to this for a year. So you don't want someone going out of business mid-year going into self-funded plan, because that could be a problem with the claims. And you don't want a high average age group. Statistically, that's not going to prove to be a good claim person. You want low turnover. Underwriters, when they look at a company, if you have high turnover, that means you're rolling the dice every time you hire a new employee. So you don't know what, you don't have a stable workforce, so they don't know what they're going to be getting throughout the year. Unless the turnovers are a bunch of young guys, like obviously they're the best risk pool out there. But wellness-minded, it's important to meet with the CFOs or the owners, because usually HR folks don't have that type of authority to make this kind of change. So, so it's important to get in front of the key decision makers if you're talking about something new. And somebody that's not jumping carriers every year. If you have a client that's jumping carriers every single year, that might not necessarily be the best prospect either. Also, low COBRA. Now, COBRA people are becoming extinct because now the individual market has no health questionnaires and it's guaranteed issue. We're seeing COBRA people just coming off employers' plans because there's no reason. They're paying 100% or 102% of the premium. So given the opportunities that employees or ex-employees are not staying on their ex-employers' plans. So if you have someone that's on COBRA, and typically in the past they've been a high claimant, that's why they're staying on the plan, you want to get those folks off the plan, at least offer them the opportunity to get off. And all of them, given the opportunity, they leave the plan. And then the last bullet, I think, is absolutely critical. Employers that are willing to meet prior to the renewal. In the small group market, you get very little time to make a decision. So to introduce a new concept with a very limited amount of time usually is not a good recipe for a group like this. Now, the stability and self-funding, typically once our groups go self-funded, they usually stay self-funded, sort of like when a group goes high deductible, even the fully insured, but you never see them going back to a zero deductible because they know mathematically it doesn't make sense. But one of the reasons why I like self-funded for my clients is that they get to choose the benefits, they get to choose their networks, they can change stop-loss carriers every year if they wanted to, but it's completely invisible to the employees. Because every time you talk to an HR person, office manager, or even the owner of a small company, it's very disruptive to change carriers. Nobody wants to change carriers, but economics will drive it. So in the self-funded world, at least in the unbundled market, it's untrue for the brokers, because if you're in a Cigna level funded plan and you're going to a United Healthcare plan, and it's like changing carriers. But in the unbundled market, where we pick the network, you pick the TPA, you pick the benefits, the stop-loss carriers are invisible to the employees, so you can shop those carriers every single year and change them if you wanted to, and the employees don't even know you did that. So it's the least disruptive changing of carriers that you can get. HR people love that when you explain it to them. Now the next couple slides, I'm going to do a little overview of Healthy Solutions, and that's the high overview and self-funding. But I want to touch a little bit on Healthy Solutions because this is a wellness program that we baked into our one of our benefit designs, and this is probably making the most difference on doing something differently that's going to bend the curve on the rising cost of healthcare, and it's really about participant engagement. And as I had mentioned, if you build, and most companies, I think in the small, medium-sized world, I'm not sure exactly what the percentage is of companies that have high deductibles, but I know it's a huge percentage of the companies. So this particular strategy is based off a high deductible health plan. And when you bake wellness programs into those type of plans, instead of just giving them the money, you bake in wellness programs so they earn the incentives to get those credits towards paying for those out-of-pocket expenses. So that's really what Healthy Solutions starts with as a benefit design. But some of the more important parts are really identifying those high-risk patients through data analysis and predictive modeling tools, and have proactive approaches to making sure those employees and dependents are getting the best care possible, and to make sure that you're keeping them out of the red. Because when we stratify the employee base in these biometric screenings and health risk assessments, we can get a bird's eye view of who the healthy people are, the moderate conditions, and then we can do outreach programs to manage those type of claims. One of the things that people don't realize, and this is an astounding statistic right here, that 70% of the nation's healthcare cost is from lifestyle-related diseases. And what that means is lifestyle-related disease means we can do something about it. The other 30% is genetics, and maybe your lifestyle might change that when a genetic chronic illness comes in, but for the most part, this statistic is saying 70% of all the claims out there are lifestyle-related, which means we can do something about it. So what are we going to do about it is the key part and where Healthy Solutions comes in. And that's just from a claims perspective, because once you're in a larger company or self-funded, you realize that your claims turn into premiums, and the premiums turn into payroll deductions. And when you start explaining this to employees, they realize that they're doing something to try to keep the costs down, and that means better payroll deductions. So we have to get everyone involved in the game to try to bend this curve on the rising cost of healthcare. Self-funding is a better way to finance healthcare expenses, but it doesn't bend the curve. It helps not give all the money to the carriers, which is a better way to finance it. But things like Healthy Solutions, the only way to get participants, everybody in the game, including spouses, because we include the spouses in this, because include spouses in a wellness program, statistics goes up 37% on the higher results by including spouses. So that's critically important, and Healthy Solutions includes them. But that's claims. Some of the other statistics are productivity, and employers also realize that healthier employees are more productive employees, not just from performance while they're at work, but from absenteeism. Absenteeism is easy to measure, or you're there or they're not. But some of the other statistics that people are trying to measure right now is what they call presenteeism. That's when you have sick employees that are coming to work but just not performing well. So these are all things that impact the bottom line to an employer. We saw some of these statistics. 67% of Americans are under 65 or under $500 in claims. But when you design a wellness program around the risk factors, and starting with biometric screening and health risk assessments, you can begin to stratify the population and really control it. Now what happens is when you incentivize, which means we're giving employees credits, and those credits turn into reducing their deductible. So if you have a $2,000 deductible and you can earn $1,500 in credits towards that deductible, so in the back end you have what looks like an HRA, you have a $500 deductible. But the only way you get those credits is by engaging in the healthy lifestyle. So it's got to be a win-win. We've done wellness programs for years for our larger clients because they know that healthier employers are lower claims. But once we included incentives where they're going to get better coverage than they have today by engaging in healthy lifestyles, then they'll all do it. Also, we have statistically the standalone wellness programs that we've had for years, about 15% of the employees engage, and that's usually all the healthy people that already get it. So you really don't get a whole lot of return on your investment in standalone wellness programs. I mean, you can do a lot to rally the employees with wellness committees and challenges and all those kind of things, which make a difference. But at the end of the day, we found that if you pay the employees to participate, they're going to do it. So better benefits by engagement is a true win-win. And that's basically what this is saying, by them having skin in the game, because it's voluntary. They don't have to engage, but if they don't, then they have the higher deductible. So when we incorporate the better benefits with engagement, we're getting 95 to 100% participation. And if you're going to get better benefits by engaging, who do you think lines up first for the wellness program? It's the people with the highest claims. And so you're getting the biggest bang for your buck by doing this. And it's all done with a turnkey process. You don't have to form wellness committees. It's all a turnkey package with our partner, Healthcare Interactive, which I think is my segue. See what my next slide is. Oh, okay. Well, this is just showing you there's kind of three parts to the turnkey package, with the awareness, which is the biometric screening and health risk assessment, which most wellness programs, that's where they end. Like the carriers, when they put these things in, that's where it ends, which doesn't engage people all year long and change their habits. So you can see through coaching and education and lifestyles, and it keeps that engagement all year long, which ultimately change habits and will change the outcomes of the claims forever. So with that, I'm going to turn it over to Chris.
Oh, she has to do it.
Yeah.
Oh, Chris, yes.
So
thank you. Switch it over to Chris, correct?
Yeah. So while Christy's switching that over to Chris Mueller, who is our representative for Healthcare Interactive, and what he's going to show you is what an employee, and if we have time, what an employer would see when they log into the system. So with Healthy Solutions, each employee has their own website where they log in, and as they complete activities, they can see how much they've earned towards their deductible. So it engages them 12 months out of the year. So Chris is going to walk us through that, and if you have any questions, we should have time at the end to answer them, so just type them on in. Okay? Go ahead, Chris.
Great. Thank you, everyone, again, and thank you, Bob. Dave, it was a great segue. We're spending a lot of time together looking at our clients and how the power of Healthy Solutions and the impact it has on not only employees, but also as a risk management tool for employers. And when we look at incentive programs, I mean, that's where we're really incenting folks financially to participate, and then we drive participation, we drive engagement, and then finally outcomes. I think, as you mentioned, being a prepackaged turnkey solution, all of the incentive plans that are built with the Healthy Solutions program are all ACA compliant, and I think that's really important to note. So I've pulled it up here just for everyone's reference that there's the opportunity, as we've highlighted here in yellow, for healthy people who already have healthy outcomes, whether it be blood pressure, cholesterol, glucose, or being a non-smoker. They can earn points for being healthy. So we're rewarding people who do have a good health. But then folks who are maybe working on their health, whether it's through digital health coaching, attending a seminar, competing in a health challenge, or tracking their diet and exercise, they can earn points as well. So really what we've done through these incentive programs with Healthy Solutions is given everyone the same opportunity to earn points, and that's really important from a compliance perspective. So just wanted to point that out. So let's take a look at what a member would see if they log into the wellness portal. Again, as a risk management strategy, what we're trying to do is really not only incentivize folks to participate in the wellness program, but also make it easy for them to do so. So in any wellness program or plan, there's a lot of bells and whistles. There's a lot of shiny things we can put in the member portal. And what we've done here is really focus the member on their incentives so they can see their rewards, the activities that they can participate in, and then finally, the ability to actually engage in the digital health coaching, wellness programming, or even engage with a nurse, an RN health coach directly. So as a member, I've logged in, and my panel will present me immediately with my point balance, my activities, or my incentives. And I'm going to pop into incentives first because that's really what most people are really looking to understand is what can I do in this wellness program to earn points and get dollars against my deductible. So what we've done, and you saw on the previous slide with the incentive program, is the activities are metered out throughout the year. So I have certain activities that are available to me based on quarter or a certain number of months, and I can earn those points per month. I can't earn them all in the first quarter. I can't earn them all in the first month or two, but it's throughout the year. So what we do is two things. One, we keep people engaged throughout the year, and as people are engaged throughout the year, they're continuing to work on their health. So if we were to give someone an incentive program where they get all their points and dollars in the first quarter, then they're done, and we're losing them for the next 3 quarters. So what we do is we transparently communicate to the employees all of the wellness activities that they can participate in, whether or not they've completed those activities, and then what they might have remaining to do in that incentive period to earn all of their points. Now, what's really critical about the Healthy Solutions Incentive Program is we've combined both participation-based and outcomes-based incentives. So what that means is if I have a lab value, in this case you can see high blood pressure, I've got my blood pressure in a certain normal range, then I've completed that activity or I've gotten that outcome, right? So it's an outcomes-based incentive. But I also have opportunities. Let's say, for example, I'm working on my blood pressure. I have other opportunities to earn the same amount of points for that time period. So again, compliance is important, transparency is important, and as an individual works throughout the year or through each quarter, they're always able to see how many points they have and then how many dollars they'll get at the end of the quarter against their deductible. So as Dave pointed out, folks who are really using the health plan are the folks that are really going to want to take advantage of the wellness activities so they can earn those points and earn down their deductible. So I'm going to go back to my dashboard. And the way we've designed this, and you can see me as I click around, it's really easy to navigate. There's a lot of computer literacy out there across the nation, and we want to make sure that everyone has the same opportunity and access to engage in the wellness program. If I move over to my wall, this is really my launch pad for all of my wellness activities. So I have a bunch of activities that I've started or have been started with me on behalf of the organization, and I can see them all here. So I can choose any of these modules to engage. I see I've got an appointment with maybe a physician that's coming up in November, maybe for a wellness visit. I'm in a health coaching, digital health coaching module for healthy pregnancy. I'm logging my diet, so I've got a food log. I'm managing my cholesterol. Maybe I'm managing stress. Some employers will actually require a cotinine test as part of the lab screenings or a tobacco affidavit. Being a non-smoker can be a critical component to a wellness program. So if I am in a smoking cessation program, and I think I have one here, yep, I'm preparing to quit smoking. The digital health coaching modules, and actually our entire approach to health coaching, is not just understanding what the individual's health conditions are, but it's also understanding where that individual is in what we call the readiness to change. What stage are they at in the readiness to change continuum? And what that does is it further informs our health coaches and our digital health coaching about how best to work with that individual. So if I'm in pre-contemplation, contemplation, ready to change, or already changing my habits, the coaching is actually tailored to my behaviors. So what we're probably going to focus on if I'm in pre-contemplation is moving someone closer to being ready to change. And then we can start to distribute content to them and work with them from a health coaching perspective that is more relevant to where they're at in the state of change. We're getting a lot better results and compliance and outcomes through that approach. So as I go through each of these modules, You'll notice they're all similar in their look and feel. We're not giving different interfaces to folks or a different way of thinking, so they always have the same interface and the same user experience. So if I'm preparing to quit smoking, and I'll jump into this module really quickly, we'll see that it's going to start asking me, how ready am I to quit? How confident am I in my ability to quit if I am a smoker? And then I'll walk through all the phases of this digital health coaching, and I will complete this health coaching module, and then that will automatically flow over into my incentive plan. So once that's complete, I get the points, and it builds every quarter as I complete my different health coaching opportunities that are available in the member portal. One of the first things that we do in a wellness plan, as Dave mentioned, is the lab and biometric screening. And that's really important for us because we want to get that baseline data about the population that we're working with. So we actually, beyond the lab and biometric data, we also look at RX data and we look at medical claims data. And what that allows us to do, as Dave mentioned, is do our risk stratification. We can understand how many folks are high, medium, and low risk. We can also understand the predicted future costs, claim costs, based on each risk group. So as an employer looking at that information, being self-insured and assuming much of the risk, it's very, very good to know what my potential financial risk is. So we'll do that financial analysis. And then we'll also run reports that look at prevalent conditions throughout the organization. And those prevalent conditions are typically things like cholesterol, blood pressure, other heart disease, diabetes-related conditions, or lab values or claims that inform us on how best we can work with that employer and their employees, and therefore what health coaching opportunities we want to incentivize and make available to those folks in the wellness plan. So rather than just create a wellness plan that is focused on exercise and diet, which is good, we're looking at specific conditions and making sure that we're addressing those conditions specifically so that we can reduce risk through improved outcomes and then finally reducing cost and really as a risk management strategy for the employer. So again, my wall is really my launch pad or the way where I manage all of my wellness activities. So if I were in here as a member, I can start a digital health coaching module. I would select which module I wanted to drop into my wall. I'd select start, and then automatically, since it's been made available to me based on what we know, again, about the organization, I've now got that in my wall here, and I can work with that health coaching module. We also make registered nurse health coaches available to all the members on the in the wellness program, and they can call in to schedule a time with a health coach. Part of the incentive plan is also a know your numbers session with a health coach. So after I go through my lab and my biometric screenings, I have the ability to have a session with a health coach and actually review all of my results. And it's called Know Your Numbers, so that I'm well informed as a member what my health opportunities are and what resources are available to me to improve my health. As a member, I can also schedule a health coaching session online. So based on who I am as an organization and health coaches that have been assigned to the Healthy Solutions program, I'll see all the available time slots, and then I would just select the time. I would go in and schedule this time. I'll save it. Oh, I already have scheduled times for this week, so it's not letting me do that. But I would schedule it at the time when I could schedule one, and it would drop into my calendar, and I see I've already got one scheduled, so it's not allowing me to do that. So there's a lot of opportunity for the member to engage in the wellness program, a lot of activities that are available based on the incentive plan that we saw. That's all here for the member to execute against that wellness plan. You'll see here at the top of our screen, we've got wellness achievement scores. I've got 2 wellness badges, and I've got a wellness score of 300. So we also have another way of rewarding the employee and providing them with achievement badges for the wellness activities that they have completed. So let's take a look at those. When I get into my badges, I'm going to see that I've earned my white belt. Well, what does my white belt mean? I've completed my health risk assessment. I am a non-smoker, so I've got my non-smoking badge. But I've actually completed 1 of 3 activities for my yellow belt. Well, the first is that I've completed my white belt. I've logged at least 7 hours of sleep for 5 days in a 7-day period. And 2 other activities that I need to complete to get my yellow belt would be joining a gym and walking a mile. And maybe that's part of a fitness challenge, so I'm already on my way to completing that. And then if we move on in the continuum here, you can see my red belt includes other activities, and then finally a black belt. So a good way socially for people to earn achievements or badges based on the wellness activities that they have completed, and to show that they're really working towards a healthy lifestyle. What we've seen is some folks have actually taken aggregate data around these badges and posted it on their company intranet or Facebook that we've got 50 people who completed their yellow badge this month or this quarter as a way of promoting a healthy lifestyle for the organization. So finally, what I'd like to do is look at the food and fitness tracker. So we're, in addition to health coaching that's available, whether it be digital or with a nurse health coach, we also want to give folks the ability to track their exercise and their diet. So the food and fitness tracker allows us to do that. We can also integrate the food and fitness tracker with devices such as Fitbit and Jawbone. So those physical activity wristband monitors that people use, they can actually log into their Fitbit account, hook it up to Healthy Solutions, and then their activity will come directly over from Fitbit or Jawbone into their exercise diary, which would then support any fitness-related incentives that are in the wellness program. So in my food diary, and let's go there right now, I can add certain items that I may have eaten every day. Let's say for lunch, I ate a Big Mac. For whatever reason, I was off the wagon, my exercise and diet wagon a little bit. But what's nice about the food and fitness tracker, and I'm using this for the example, that it gives us our nutritional value for each item. So if I am watching my diet and I slipped and I ate a Big Mac, I can see what that impact is. Or as I'm analyzing my diet and planning my diet in the future, I can always select a food item and I'll get that nutritional value. So as much as I'm actually tracking what I'm consuming, I also have the ability to understand more about that food, and it helps me with my planning in the future. So I'm just going to say that I did eat that Big Mac today, but I also did some exercise. And so I'm going to go into my exercise log, and you can see the default is 24 hours, so there's a 24-hour time period, and I can choose what exercise I may have done. And Dave and Bob know I just love badminton every morning. So I got up early, and I did badminton for an hour. I'm going to add that to my exercise log. So instead of sleeping, I've got an hour of exercise. And you can see in my diet calendar, and I'll shoot over there right now, in my diet calendar for today, I have a net burn of 1,911 calories. So, or excuse me, 1,361 calories. So every day where I've logged activity, or every day where I've logged my diet, I'm going to get that net burn or that net consumption, basically, based on my diet. So it's a great way, whether it's through a challenge or whether it's just someone who's working on their exercise to contribute to their incentive plan, a great way to keep track of that information. From a member's perspective, we also have the ability to bring into our benefits area. They can look at the incentives or any health plan information, which might be summary plan information or documentation. But we can also bring medical and RX claims into the member portal. So beyond wellness, we also have the ability to bring in that plan data. So the member, if they want to see their pending claims, their processed claims, they can also view that information here. So it's really kind of a one-stop shop for all of their health plan information. And of course, the member will always have the ability to manage email alerts. So when there's maybe a challenge that is created by the organization, that will automatically populate to my wall, so I can set what notification schedule I want for either wall messages, appointment reminders, medication refills. Again, we're looking at RX data, so we're going to get fill data as well, and the individual can actually get reminders for their prescriptions. And then finally, in communication, the individual, the member, has the opportunity to look at their calendar, schedule time with a health coach, which we looked at, and then look at any possible pending appointments that I have coming up as well. So there's a lot here for the member to engage in the wellness program, the health plan itself, and we're really focusing them on those incentives that contribute to their deductible reimbursement and improve healthy outcomes. So I think Bob, I'll pass it back to you. We can start to take some questions.
Okay, I will
Or
shoot
Christy?
it back to Bob. And let me pull.
Thank you, Chris. As you can see, there's a lot of information in there, and I know as people log into that, they're not going to use all of the information in there, but Chris showed you where you can go in and go through the activities to earn away your deductible. So I'm sure people will concentrate on that, and then once they get a little comfortable with the system, they'll click around and maybe go into that diary where you log in the food you eat and the exercise and see the net burn, like Chris was saying. So we're just going to cover a few other things, and then we'll have some more time. We'll have some time for questions. But what we're going to cover now is what you would need to submit for a quote.
All righty. And the final slide about self-funding. And most people, usually when I do lectures and I'm in front of a bunch of smaller or medium-sized employers, and I say self-funding, I hear them all sucking air. And at the end, it's really not about risk. It's about the plan design. As you saw in the previous slides, you buy stop-loss insurance to protect you against individual high claims or even as an aggregate. So you know what your maximum exposure is in worst-case scenario when you go into it. So really, it's not about the risk. And then, of course, Chris was just going over our wellness program built into the benefit design. And I can tell you that the stop-loss carriers are giving great discounts when we put these type programs in. So if you saw a comparable deductible with the same type of HRA reimbursement with Healthy Solutions and without Healthy Solutions being the same exact benefit design, you're going to get about a 12% reduction in aggregate attachment points, which is that claims fund. 12% differential, and that's huge, just for the same benefit design, but with the wellness baked in. So that's how much confidence the underwriter has at programs. So next steps, I did want to show you a sample RFP. The request for a proposal is critical. Once you're breaking out the small or medium-sized, fully insured market, you need more information in order for the underwriter to feel comfortable to get a good quote. So I want to show you, let me pull up a sample. Where is it? RFP. So here's a sample RFP. And you can get this email to you in Excel. And so it's a fillable Excel form once you get it. So it's all electronic. But it's basic information about the company, contact information. Here's the broker information. If there's a specific compensation you want, you can put it in here or just say match the current. Some demographics. Most important thing, here's their current premiums and benefits. And there's a reason why this is typed in. A lot of people will send the renewals and it has all this information in there. But ultimately, it has to get into this form because all this transfers in the proposal system. That's why it's important to have this electronically. But you might have up to 3 or 4 different plans, so that's why that's there. But here's the most important. Under the requirements checklist, depending on the group size, we require more information as the group goes up because the underwriters realize that as the group gets larger, you get more information. So they're going to require more information as the group size goes up. So the 5 to 30, they realize they don't get any claims experience. So we can just get a census. If you give us the current benefit designs, we can match them. So that's for the small groups. Mid-sized groups, we can make the benefit design anything you want. So the most logical thing is give us the current benefit summaries so we can match them. So when we're doing a proposal and you're seeing a side-by-side comparison and the prospect or client is seeing exactly the same benefits, it's a lot easier to show that apples-to-apples comparison than it is to explain self-funding and a different kind of benefit design. So, and then as you go into larger groups, you get more claims data. And don't think for a minute these underwriters don't know the carriers and what they give you, because they do. So the different carriers, depending on the size, will give you different types of claims data or high claimant information. So if those carriers are giving that out, these underwriters are going to want to see that information. So for the 51 plus, here's the checklist. So if you can't remember what you need, depending on the group size, this checklist is baked right into the RFP. So this is your reminder. And then if they have, a small group, we have the CAN packages. Mostly everybody, this box right here, it says check to match the current benefits. If you're going to check that, please include their current benefits. Because we'll get people to check that, and people don't tell us what they have. So the underwriters kind of push that back. And then if you want custom plans, you can fill that in here. So it's a pretty simple RFP, but I can't, everybody wants to take shortcuts and just get us limited information. But I just wanted to stress how important it was to get all the information. So we can do a good job for you. And then once this goes in, the underwriter does their thing. So they have different tabs because this is an Excel spreadsheet. When you get the RFP, you're going to get, it's going to have 3 tabs. That sheet I just showed you, the next tab is just a group disclosure saying, to the best of your knowledge, are you aware of any of these claims going on? And then the third tab is the census. And the census will prompt you the information we need. The birth dates and zip codes are important for network purposes. So, and then once that comes back to us, the underwriter opens up their hidden tabs, puts in their underwriting information, and when they're finished, they close those tabs up, and then we open up the proposal tabs. This is what the proposal will look like. Cover page will have the happy, smiling people. Why would you want to do self-funding, some of the features, the assumptions, what we base the proposal on. And then it will show you these bar charts like I showed you in the slides. In the proposal, it will show you the current plan with all the fully insured premium, all in yellow. You'll see our expected claims, the maximum claims. So you'll see this picture to kind of demonstrate a concept of the funding arrangements, which is a nice thing to start with. And then the next slide will be the current plan and their renewal in a fully insured format that they're accustomed to seeing. And they'll see the renewal with our GBS plans formatted in that fully insured lookalike. So it kind of makes sense to them in a format they're accustomed to. But the only difference you'll see down here at the bottom in the green and yellow that matches the bar charts. The green or the red is that, or red. The yellow is that fixed cost, the fully insured premium part of it, and then the green is that claims fund. So you'll see the difference down here at the bottom showing the claims fund. And then here's that full-blown analysis of how you get to those premium equivalents. It shows all the gory details that most companies aren't used to seeing, the administration fees, the rentals, the PPO rentals, and all that kind of stuff. So never start with this analysis page right here because they're not used to seeing this, and it'll just confuse them. Matter of fact, this part of the presentation is what we encourage you to have GBS reps. We see these things every single day, so I encourage you to take us out on these groups, or at least from a webinar perspective, to show the groups. Use GBS personnel. These are the premium equivalent worksheets, and usually this started off, we started doing this for our self-funded clients that they need a premium equivalent for COBRA people. So now a lot of our employers want to see this for payroll deduction purposes because that's how they're accustomed to setting their payroll deductions. And then contingency page, if there's something else we need is the parts of bind the group. That's what this contingency page will be about. Some setup fees. And then if you want to do, there's lots of other ancillary type services we can do, so it'll just be a cost page. So that's what the RFP, the original RFP that you'll get sent, when you send that back to us electronically, that's what it will turn into. That's why it's important to have all that information, so it turns into a beautiful presentation that looks simple for your clients. Do I have anything else here? Oh, okay. We had some states. I'll show you the. But again, what's important is to have completed data. It's necessary to get meaningful quotes from our stop loss carriers. Please, I said this earlier in the PowerPoint. I think it's important to get out prior to the renewals to explain a new concept. If not seen self-funded, at their renewal is a bad time to explain a new concept. Some people get it. CFOs get it. They look at the numbers and go, I get it. But if it's HR people or even some busy owners, and they have limited time to make a decision, it's very difficult to get their attention to explain a new concept. Again, I offered GBS personnel, whether it's face-to-face or if you're in Texas or California, maybe WebEx, so we can walk through these type programs with your clients. Also, a lot of our brokers are using us to do seminars and webinars to their prospects and clients. So, feel free to take us up on that as well. But I think that, as far as the kind of high-level overview of our programs, I appreciate everybody's attendance, and I know that I think we're giving folks an opportunity to write in.
Going to field questions.
Okay. Yeah, we don't have a lot, but we do have questions. I'm really impressed with that wellness tracker, and there's some days I wouldn't want to type in what I have for lunch, but and I did notice the bottom left, it was powered by something called Fat Secret. I'm like, oh boy. So yeah. Yeah, I guess.
Yeah, and Christy, well, one of the things we didn't have time to do, but we could maybe do on another seminar is we showed you what the employee sees. Now, the employer will get a roll-up of all of their employees, of course, without names, but they can see all the conditions and all the claims, and there's a lot more reports that the employer can see.
Can the employer see what the employees are eating for lunch?
Yeah, no.
Okay, good.
All right.
Okay, thank you guys. Great presentation. And first question is, maybe we have a copy of the slides. Yes, I know some people have logged off, so yeah, actually this is recorded, and if you shoot me an email, again, it's Christy, S, K-R-I-S-T-I, S as in Sam, Christy S at URLINSgroup.com. I do have a copy of the PowerPoint, so I can send that to you, and also within about, I think it's about 24 to 48 hours, we did record this, so if, maybe you missed some of it and you want to watch it again, then you will get the recording of it. Same question.
Christy?
Yes.
Hey, Christy.
Yes.
Yeah, we'll have it up here pretty soon. It'll be on our YouTube, and then a follow-up email will go out with the recording as well. And then anybody on here that would like us to follow up with them, if they would click on their screen yes or no. Obviously, if you're interested, we want to connect with you, but if you're not, we don't want to bother you. So if you could, everybody click yes or no on the screen, and we'll follow up.
Okay. Next question is, do your stop-loss carriers laser claims?
The smaller groups do not. When we're doing those premium equivalents, they do not laser claims.
And I'm sorry to interrupt you. Could you maybe explain what laser claims is? Because I know we had this question before, and a lot of people might not know what lasering means.
Oh, okay. Well, laser is when they pick a specific person that has a higher claim. So when I was talking about those specific stop-loss carriers, they have specific deductibles. They'll put a higher deductible on a specific person to keep the premiums down. And so a lot of times people think lasers are bad, but say your specific deductible might be $50,000 on a group of 100 employees. And this one particular person has a high claim. Say they have $150,000 in claims. So you have two choices at that point. Either keep the specific deductible at $50,000 and raise the premium, or take that one person and make them a $150,000 deductible and keep the premiums the same. So a lot of times you might get the option, and most times you do. So it's all in the idea of managing the premiums and the claims. So that's a laser is when they have a higher specific deductible than the rest of the people. Okay. And there's pros and cons to each, and that's if that happens. That happens in the larger group market. If that happens, then we do the analysis of what we think is the best way to go, because we'll do the analysis on both ways. Pay a higher premium and keep their specific deductible 50, or look at the premium reduction. So you're going to look at the annualized premium, compare it to that potential claim that could be $150,000, which is going to use up that claims fund. So that's what a laser is, and some of the larger companies do that, and it's to keep that fixed cost down.
Okay.
Is that clear? Yep.
Yes. And somebody had asked for my email address again, so I went too fast. I apologize. I put it back up there with my extension, and again, John Reels and his email address, and our website and user ID and password to access that. Next question is there a list of states where GBS operates? And I think, Bob, you had given me that before. Yes. So, yes.
Yep.
So, Walter, if you want to shoot me an email, I do have that in PDF. I can send it to you. Next question is, I said the word Fat Secret. Fat Secret has a mobile app. Would this integrate with the online wellness piece?
Yeah, it's a great question, and I should have mentioned that. This is Chris. The member portal is available on Android or iPhone as well.
Okay, great. Next question is, how does this qualify under ACA? And I know that, but I'll let you guys answer.
Well, that's about an hour presentation right there.
Yeah.
Well, ACA says there are specific requirements to meet the affordability test or compliance test for a qualified health plan. And but when you get into the self-funded world, you don't have to have those same requirements. So self-funded can actually step outside of some of the ACA requirements. An example, in the small group, fully insured world, you have the 10 minimum essential, or 10 essential coverage, which includes hospital, surgery, maternity, prescriptions, emergency rooms, things like that. There's a list of 10. In the self-funded world, you don't have to offer all 10. You can offer one. And but when you offer one of those essential coverage, then it must meet the ACA requirements. An example, some of the large companies out there that didn't offer coverage, they're offering plans called MEC plans. It's a minimum essential coverage, and it's basically one of those essential coverage, and it's preventive. So once you offer a preventive coverage, then it must be no cost sharing, no co-payments, unlimited lifetime benefits. So, but it's all just preventive coverage, so it's not a high-risk product. But by offering that one essential coverage, takes these large employers off the hook for that $2,000 penalty. And so that's the kind of creative stuff you can do that does not have to meet the full definition of ACA. So you can pick and choose which one of those essential coverages that you want to include in your package. So that's the short version.
Okay.
And because everybody's trying to get that, and then the affordability test, you must at least meet the 60% actuarial value, and then not charge more than 9.5% of the W-2 for that for the individual coverage. So so it doesn't meet that part of the ACA requirements, but you can still offer, as long as you have a 60% actuarial plan, it satisfies the affordability test as well. So self-funded, if somebody wants to get creative, normally if somebody has a current plan that has all the state mandates and has a qualified health plan and they're asking for a quote, we just usually match it. It's the larger companies that want to get creative and try to keep the cost down that they start asking those questions. So if someone has a large company that wants to get creative and break outside of the ACA requirements, then that's something they should talk to us directly with.
Yeah, and Christy, a lot of times if someone's getting into self-funded for the first year, it's always good to, look at all of those individual line items maybe the second year, because we'll give you, tons of claims information and usage for different services. You'll have more information to see which services are used more and which ones you could either increase the deductible, increase the copayment, decrease the copayment, or completely cut it out if no one's using it to help control the cost.
Okay, Great. Next question is, in Pennsylvania, will small groups with 25 or under be able to realistically benefit from self-funding?
No, the Pennsylvania law says that the aggregate stop loss deductible has to at least be $100,000. So just think in terms of that 50% claims fund being the aggregate stop loss premium. So if Pennsylvania has a $100,000 minimum, then as an average, the group must have at least $200,000 in fully insured premium. That's a benchmark, because it's really not the number of lives, it's how many families you have in there that's going to get that premium up. So usually we find that it's about 35 employees if you have families, probably 50 employees if you have very few dependents on there, because it has to get to that $200,000 fully insured premium.
Yeah, take a look, like they said, take a look at their current premium, and if it's around 200,000 or more, then we could probably do something for them.
Okay. Excuse me. Is Pennsylvania the only state
that has that requirement?
Yes.
No.
There's other states that have requirements like that, but it's I think Pennsylvania has the highest aggregate minimum.
Yeah,
fantastic. Thanks.
Sorry, I didn't make the rules.
I know. I'm joking.
In one of my recent emails to you, I sent you an updated form that covers all the states.
Okay, perfect. Next question is, where can they email quote requests to? Brian, that would be to either myself or to John in my office, John Reel, who's our group case manager. And again, if you shoot me an email, I can send you over what Bob and Chris had gone over as far as what is needed for a quote. So, a lot of times I'll just get a census and an agent will say, well, give me a self-funded quote. Well, we do need a little bit more than that. So again, I can shoot you over all the requirements we need to get a quote. Next question is, which carrier networks do you rent?
If it's in the Mid-Atlantic area up through Pennsylvania, OneNet is a good, it's owned by United Healthcare, is a good network. First Health is another good national network. That's Coventry owns them, or Health America in the Pennsylvania road.
Right.
And PHCS is a big national network owned by Multiplan. They're the bigger national ones. And then we have smaller regional ones, like in Philadelphia we use Devon, and there's more regional type networks that we use if employees are in an area. But what we do in the census, we ask for these zip codes. So depending on where the employees are, we will do what we call geo match, and match up the right network for the right employees. And you can have multiple networks. If all your employees are in South Central Pennsylvania, we might use First Health or OneNet or something like that, or PHCS. And if you have employees elsewhere, we'll come up with those networks. You don't have to think about it. Let's put it that way.
Okay, thanks. Next question is the turnaround time on quotes.
It's usually around 2 weeks if we have all the information.
Yeah, once we have all the information in hand, it takes about 10 business days, so about 2 weeks.
Okay. Next question is, so if it doesn't meet the full definition of the ACA, what happens if an employee refuses the plan and goes directly to the exchange?
Well, if you're offering a compliant plan and waives coverage, they can go to the exchange. They just can't get a subsidy.
Okay.
And the employer is still off the hook because you offered a compliant plan. So I always coach employers to make sure to get those waivers, because that's your word against theirs that you offered it to them. Because if an employee, or yeah, I will say, if an employee of a company that's offering a compliant plan goes to the exchange and lies and says my employer is not offering a plan and gets a subsidy, the employer is still going to get the love letter saying you owe $3,000, but that waiver will be your evidence that you offered it to them. That waiver is worth $3,000.
Okay, thanks.
You're welcome.
Next question, which I don't completely understand, but maybe you guys will. And how will the stop-loss carrier go for SPEC, S-P-E-C? And Matthew, I did try to get you to clarify that. I didn't get a message back, or if I did, I can't see it.
Is the question, how does the underwriter determine what the spec should be?
No, the exact question is how low will the stop-loss carrier go for SPEC, S-P-E-C?
Oh.
So,
Okay. That's the spec deductible. And that varies per state.
Thanks.
That varies per state. Maryland is 10,000. Let's see. I'm looking at the folks that may have logged in. Georgia is 6,500. Arizona is 6,500. Florida is 20,000. I'm thinking the people that's, and a lot of states don't have a minimum.
Yeah, and Christy, on that sheet that I gave you that went state by state, a lot of that information is included in there. It talks about the minimum or the maximum, and it kind of gives more information.
Also, something we might send to you, Christy, is Bob sent me the list of attendees, and it showed all the states. So I took that list and dropped in, just based on the states of the attendees, what the rules are for the state. So that might even be more specific.
Perfect.
You don't have to wade through all 50 states to find your state. So that's a good one.
Okay.
We'll send it off
Great.
to whoever requested. And we know what those requirements are. So if you send over a RFP, we're going to know how to quote it.
Okay.
Now, for some reason, like it's Pennsylvania, send over a 10-life group, you'll quickly learn that that's not big enough, and then we'll tell you. If you're not on the line right now, I'm not learning 100,000.
Yeah, unfortunately, we learned that the hard way with another carrier, which I will not mention.
Mm-hmm.
So we kind of got burned on that. The carrier didn't put that in, and agent had sold group and went back to say, whoops, that's not the right premium. So
Yeah, from us, you won't even get you won't get a quote.
It's not legit. Yeah.
yes.
And you'll know why.
Yeah. Next question is, so a plan is still considered compliant even if it doesn't meet all the essential benefits as stipulated by the ACA?
Correct. In the self-funded world.
Okay. I think that might be it. I know, Bob, Susan, are you on the line? I know we've gone an hour and a half, but I know Susan Schulman, who we partner with for our group GAP plans and the self-funded, was going to be on the call, and she wanted to at least
I'm still on the call.
Okay. Sorry, Susan, we went long. Do you want me to show your screen for anything, or you just want to?
Yes, I would like to just show the screen, and just, if we have a minute, I'll just say a few words.
Okay. And if anybody has questions that I did not, I think I got through all of them. All right, there you are, Susan.
Okay.
And guys, I know we're going long. For those of you who are still on the call, I appreciate it's valuable information. And I kind of wanted you to hear a little bit about the group GAP plans as well. So, Susan, it's all yours.
Okay, thank you. I'll talk a little bit fast and just give you some ideas. My philosophy in this whole realm of change has always been, with change comes opportunity. And I started about 5 years ago to blend gap insurance with our traditional plans, because here in Florida, where I'm located, we were selling plans last year that had 10,000 deductibles, something that you probably haven't seen in Pennsylvania and many other states. But I was using gap insurance that would pay the benefits down to the first dollar all the way up to 10,000. Well, that's changed a little bit over this past year. In looking at healthcare reform at our heels, I started to do a lot of self-funded. I love self-funded. It works very well, but I have to encourage you, number one, to do some field underwriting before you even think about self-funded. Because I have agents that go, yeah, it's a healthy case, yeah, no problem, whatever, and then we find out there's an HIV and an MS and, a lot of other things when we go to do the underwriting. So that's really important. But along with that, adding gap to your low-cost medical plans is the missing piece of the puzzle. And which works better, a low deductible plan that meets your client's benefit expectation, or using a low-cost, high deductible plan and blending it with gap coverage? A plus B equals C. It will always turn out that the cheaper the medical plan, the higher the deductible, with the gap plan will always cost them less. And with self-funded, where you're looking to return at the end of the year the money that is in the claims fund, this is a great way to ensure that if you are paying the first $5,000 out of gap benefits, you're not touching the claims fund, and that leaves more money in there. And thinking about the screen that was just recently shown, that the claims never seem to go over $2,500 for an individual, or very few of them do. Wouldn't it be nice if all the claims under $2,500 were paid from gap money rather than from your low deductible plan? So I just have this flashed up there. I know this is run over, and do let us quote both your self-funded with gap and see what a difference it does make. And I'll just end it there. I know we've run over.
No, I mean, there was so much great information. I'm going to actually want to watch this webinar back again. I'm weird that way, but so much great information. I want to thank, there were so many presenters. You guys all did a great job. I want to thank Bob and Dave and Chris and Susan. Again, you'll all get this recording, and you have my email address. If you have any questions, please give me a call. And please let us try your groups. Again, the more information we have, the better, but we've seen some really significant savings. And again, I think it's really time to look outside the box, because most brokers aren't going this route, and you're going to set yourself apart and save your client money and hopefully get your client money back at the end of the year. So with that, I'm going to end the webinar. Thank you all so much, and have a great afternoon.
Thank you. Bye.